Hi, this is Dr. Fruth, family physician, and this is today's consultation. I've seen a lot of cases of the flu lately, so I think that this is a good opportunity to talk about seasonal influenza, the type of flu that comes in the United States between October and May. If influenza is notable in your community, there's two things I want you to recommend. One, it's not too late to get the flu shot. It does take about 2 weeks before the flu shot is going to protect you from getting influenza, but it's worth the effort of getting it. And remember, you can't get the flu from the flu shot. The second thing to remember is that there are antiviral medications available for people who are in high-risk groups. The antiviral medications decrease the severity of symptoms and decrease the length of influenza by about 1 or 2 days. Those people who are in high-risk groups include young children and babies, pregnant women, elderly people, community dwellers like people in nursing homes, and people with chronic illnesses such as asthma or COPD, neurological conditions like Parkinson's or multiple sclerosis, diabetes, people who have immune disorders with things like HIV, or blood disorders like sickle cell. So be sure you contact your physician and find out if you're in a high-risk group. The flu is a respiratory virus that is highly contagious. This means it infects everywhere from the lining of your nose all the way down to those tiny airways in your lungs. And most of the time, flu is associated with snot, sputum, and stuffy nose. So when I see someone with a lot of goo and a high fever and looks sick, I think that's the flu. And don't get confused by what people call stomach flu. That's nausea, vomiting, and diarrhea that could be caused by a virus, a bacteria, or a parasite. We're talking about the respiratory illness called influenza. Well, how do you know if you have influenza versus the common cold? Well, it can be kind of hard to figure out because sometimes influenza has very mild conditions and mild symptoms. But one thing I've learned from people who have had the flu, and they commonly tell you, is that influenza tends to come on like a ton of bricks. It hits you very quickly. You might wake up in the morning feeling okay, and then by the end of the day feel very ill. And the kind of symptoms you're going to have are fever, chills, headache, runny nose or stuffy nose, sore throat, a rattly cough, and fatigue. The recovery time for influenza is anywhere from a few days to a couple weeks, and you might expect that cough to last a whole another week after that. Remember that it is highly contagious, and a cough or a sneeze can cause droplets to fly as far as 6 feet and infect somebody. And you can also become infected just by picking up the droplet from a hard surface and then putting that in your eyes, nose, or mouth. And influenza is really a sneaky virus because you can be infected one day before you even know you have the flu. And when you are infected, symptoms begin about 1 to 4 days later. Well, if you think you do have the flu, should you see your physician? Well, definitely if you're in one of those high-risk groups that I talked about, maybe young children, pregnant women, elderly people, and people with chronic conditions, asthma, COPD, diabetes, HIV, MS, etc., you would want to at least contact your doctor and see if an antiviral medication is indicated for you. And you might be wondering about the rapid flu test. This is a test that can be done in the office to help determine if someone has the flu. Well, a couple things I remember about the rapid flu test. One thing is I treat the patient and not the test. Because in the middle of flu season, if it looks like a duck, quacks like a duck, it's probably a duck. The problem with the rapid flu test is this. Up to about 30 to 50% of the times, it could be wrong. You might have the flu and the test would come up negative. The other problem with it is choosing on when to do it. For instance, if in the middle of the summer, 100 people walked by and you did the flu test on them, 10 would come up positive. So again, the flu test is something that can be used to help the clinician kind of evaluate whether or not flu is in their patient population. And most clinicians know that in the middle of an epidemic, the rapid flu test is probably not going to be helpful to determine whether or not you have the flu. So what should you do if you get sick? Well, first of all, stay home. You may think we appreciate you drumming up business for us by going out and infecting everybody. Well, no, we don't. Stay home, rest, take medications like acetaminophen or ibuprofen or naproxen to feel better. Don't give aspirin to children because of the risk associated with Reye syndrome. Take the noodle soup or the chicken noodle soup that Grandma told you to take, and remember that you probably want to be sure that you're afebrile or without fever for at least 24 hours without using medications like Tylenol or Motrin or ibuprofen before you return to work or school. And in general, influenza is not a reason to go to the ER. Things that would be emergencies would be people with influenza who may appear dehydrated or confused or having difficulty breathing or just seem very, very ill, so much so that they just couldn't even take care of themselves. Well, one last tidbit about influenza that is not, I'm not mentioning it to scare you, but to give you respect for how serious influenza can be. In 1918, there was a pandemic of influenza in the world. 500 million people became infected with influenza. That was 1/3 of the human population, and at least 20 million people died of influenza in 1918. Our infectious disease colleagues are vigilant about detecting influenza and how severe it is, and all worry about the big one that could develop. So again, protect yourself from the influenza by getting a flu shot. Know about antiviral medications should you be in a high-risk category or if you are very ill from influenza. This is Dr. Fruth, family physician. This was today's consultation. Please like, share, and follow, but this is an educational video. So please consult your healthcare professional for personal medical advice about your healthcare concerns.